it's Dr. Murphy. So today we're going to talk about hypertension, and that's the medical term for high blood pressure. So, what is high blood pressure? So, that's the force we're measuring of the blood on the walls of your arteries whenever your heart is squeezing and relaxing. And so, the top number is the systolic blood pressure when your heart's squeezing and pushing the blood through the body. And the bottom number is the diastolic blood pressure when your heart is relaxing and filling. So now the criteria has changed of what we consider high blood pressure or hypertension. Years ago, it used to be 140 over 90, but now the cutoff is 130 over 80. So whenever your blood pressure is checked at the doctor's office, if they see that your blood pressure is around 120s on top, they may let you know that your blood pressure is elevated, but not true hypertension. So that's just to give you a warning that things are almost borderline so that you can intervene and kind of make some changes to prevent full-blown hypertension. So there's various causes for high blood pressure. Sometimes it's genetic. Sometimes it can be caused by things that you're doing in your day-to-day life, such as taking medications over the counter regularly. NSAIDs and decongestants are two of the more common over the counter medicines that can cause high blood pressure. If you're a smoker or if you drink alcohol, those increase your chances of high blood pressure. If you have other health problems like lung problems or heart disease, diabetes, kidney disease, those things we tend to see along with high blood pressure. So there's different things that can cause it. Weight as well, obesity or being overweight. We tend to see higher blood pressures. Age, as you get older, your risk increases. So there's different causes, and depending on what your unique situation is, kind of will tailor our treatment plan for your blood pressure. So lifestyle changes is the big one. We want to try that first to get your blood pressure under control before medication. And that depends on how high your blood pressure is. If it's extremely high, we may have to use medicine to get it down to a safe range immediately. But if it's not too high, we can just work on the lifestyle things first. So, eating. The biggest things that research has found to make a big impact on blood pressure is controlling your sodium intake. Typically, we recommend less than 2,300 milligrams of sodium. So you would have to pay attention to your nutrition labels and look at how much sodium is in each serving and kind of keep track so that you know you're not eating too much in a day. And if you're not cooking at home, it may be harder if you're eating at restaurants or fast food because you don't know exactly precisely how much they're putting in it. But thankfully, most places now do have their nutrition records available where you can see an estimate of how much sodium is in their food. Before we keep going, make sure you go and like and subscribe my channel to help us keep growing. So for some people who don't really like reading labels, some of the general ideas to keep sodium low in your diet is to try to eat fresh foods, plenty of vegetables, fruits, and try not to do a lot of processed foods or packaged foods because they have a lot of sodium hidden in those. It's in canned goods as well. But aside from sodium, some of the new recommendations encourage potassium in your diet, maybe about 3,000 to 5,000 milligrams if you're paying attention to the amount on the labels for potassium. And so some of the salt substitutes when you're in the grocery store shopping will have potassium chloride. So that will be okay for you as long as you don't have kidney disease or some other restriction where your doctor tells you not to have potassium in your diet. So aside from diet, exercise is helpful for blood pressure as well. We encourage at least 30 minutes of aerobic exercise where your heart rate is going 4 to 5 days a week would be great. Resistance exercising, weightlifting, where you're building the muscles, those are all good for your blood pressure and your heart health in general. You want to make sure you're getting good sleep. A lot of people neglect their sleep and don't understand the importance of it, but try to make sure you're getting at least 7 hours, 8 hours of sleep every night. Make sure that you're managing your stress as well as you can. Just, being proactive, make sure that you're taking good breaths, that you're doing things that help you relax, whether that be listening to music or journaling or whatever it is. Just do things to keep your body relaxed and de stressed. So, aside from the lifestyle changes, of course, there's medications that we can use in conjunction with that to help get your blood pressure under control if that's needed. And there's different classes of medicine. We choose it based on each individual patient's whatever conditions they may have, maybe even your job, like how often you can take medicine may impact what medicine we choose. The side effects of medicines, we have to consider um, if the medicines will make you pee more, because for some people that's not going to fit into their everyday life for them to have to go to the bathroom often. So there's various things we consider with selecting the right medication for you. Sometimes we will start a medicine and slowly increase it as we need to until it maxes out before we add a second medicine. But now we're starting to see that using two medicines inside one pill may work better for you. So you and your doctor will determine, what plan is best for you. I could do a whole segment on medications and, dosing and side effects and monitoring. So maybe that'll be something we talk about later. So if you have any specific questions about medicines for blood pressure or any general question about blood pressure itself, just leave a comment and I'll look at that and maybe I'll put that in a future segment. So once we start medicine, it's important for us to do monitoring where we bring you back in a few days or weeks to check on the blood pressure response. And it's also important to do blood work, especially with some particular medicines where we're checking your electrolytes, your kidney function, things like that. So just know that if you do start a treatment, it's important that you have a clear follow-up plan and not just be taking medicine for months before you see your doctor again. So the purpose of treating you and encouraging you to adopt a healthier lifestyle is because we want to prevent the dangers of high blood pressure, the downstream complications, which is kidney failure, heart attack, congestive heart failure, stroke, brain bleeds. There's lots of health complications that we see with high blood pressure, and it's pretty common. High blood pressure is pretty common, so we want to do our best at reducing your risk of having those outcomes. So, aside from that, one of the big things I think is just for you to know how to monitor your blood pressure at home. You can get a blood pressure cuff from the regular pharmacy or whatever store you normally shop at. There's some cuffs that are more recommended by the Heart Association because they're validated. So you can go to validatebp.org and they have a list of companies that they would recommend for you to get the blood pressure um, machine or cuff from. And so I would look at that and just make sure that you're taking the proper steps to get an accurate blood pressure. So make sure your bladder is empty. Make sure you're sitting for at least 5 minutes before you check your blood pressure. Ideally, have your arm elevated, propped up on a table or something to keep it elevated near your heart, and make sure that you don't intake any like caffeine or smoke a cigarette or do anything like that within 30 minutes of checking your blood pressure. And it's good to take it in the morning and again in the evening so we kind of can compare times and keep a log of that so that you can take it with you when you go back to your doctor for follow-up. So we really want to do everything we can to prevent high blood pressure. And if you do have high blood pressure, we want to prolong the time before you get complications or avoid them altogether. So that's my segment on high blood pressure or hypertension. Until next time, y'all take care.